So, I mean, those are really huge numbers, when we talk about these reports and these surveys that you shared with us. Uh, so, what do you think are some of the key reasons, or some of the main points that are causing violence to propagate or grow up in these demographics?
So, the issue is not about, one of the things that I really want to highlight is that in India, there is a massive underreporting of incidents. See, nobody wants to report, nobody knows how to report, where to report. So, the statistics that you find probably would be a fraction of what is happening actually on the ground. So, that's something that we also need to understand. We can't just say that, it's okay, 50%. Maybe it's much, 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 much higher. You talked about reasons. Now, I have analyzed this issue and I put it across into five major causes. I'm clubbing one group as a triage of overcrowding, faulty design of facility, and understaffing. This is one big thing. The second one is the lack of support system, and the third one is about society itself. So under the overcrowding business now, we have seen public hospitals, we have seen government hospitals. They are built to cater to an X amount of patients. Invariably, you find that by the time the hospital becomes functional or it's really doing well, the number of patients that are utilizing those services are probably 5x or 10x of what they were meant for. So overcrowding is a major, major, major issue. And the second thing is the design of the hospital itself. So hospitals designing as architectural design are not taking into account one big factor, which is, can this facility be designed in such a manner that it protects the healthcare worker from harm? Now, if the facility is not designed in this manner, it is an open system, then the chances of getting subjecting to the violence is much higher. Now, one of the things that when I do work with my clients is the mindset of the people. So I remember I talk with people and they all have very grand plans of I want to build a premium hospital. It should be world class facility, GCI accredited, blah blah blah. And when we are looking at space planning or we are giving them architectural briefs, we find that especially the middle management type of people, they are saying, "Oh, why do we need to give space to doctors? Why do we need to give space for staff? Let's reduce that and use that space maximum for revenue generation, which is put another bed." With this kind of attitude on space planning itself, we are going to be in trouble because when you don't give proper uh, design and you don't give proper space for healthcare workers to actually carry out their work, you are actually asking for trouble. So this is what I mean when I say design of the facility. The other thing which is part of this is understaffing. Now, I'll give you an example. What is understaffing? So let's say you build a nice big hospital and you say, okay, I'm catering to 100 inpatients in emergency. And I'm saying that, my human resource planning for nursing would be that we will be doing a 1:4 ratio for nurses in for patients in emergency. So which means that for every shift there will be 25 nurses. Now when the hospital actually becomes functional, you will find that instead of 100 patients, there are 400 patients or 300 patients. But the number of nurses is only 25. So your ratio is anyway gone. So the level of care that is given is not unacceptable to both the healthcare workers, the patients, their relatives. And these three things, overcrowding, faulty design, and understaffing, all of them create a kind of a pressure cooker environment in which everybody is stressed. The healthcare workers are unable to provide services, the patients feel deprived, their relatives are observing and getting upset, and all of this is creating an atmosphere which is just waiting to get into some kind of a confrontation or some kind of a problem which is waiting to happen. I mean, if you go to a government hospital, you find that patients are, in emergency, patients are lying two patients in a bed, or maybe up to three patients in a bed. Patients are lying on the floor. There are patients lying in the corridors on trolleys. Difficult for us to treat them, difficult for us to examine them. Imagine a patient is lying on the floor. How do you examine the patient from? You have to kneel down and look at them. How does the nurse give IV lines? How do they actually treat the patient? So all these problems are there, and the patient's relatives are watching. They're observing you from all over, and they get upset when they see that the care is not being given them what they are expecting. So yeah, these are three. One big area which is the pressure cooker environment, which is causing this. The second big chunk is the lack of a support system. Now, what is this lack of support system? Uh, on top of this list of the lack of support system, I would put it as management indifference. Now, whether it is private sector or public sector, there are the senior people who actually make decisions. In a public sector, it will probably the secretary health or principal secretary health or some bureaucrat there. In the private sector, it will be the CEO or some C-suite executive or the board. Now, they are first of all insulated from these things. They don't get to know. One. Number two, even if they get to know, it's a trivial incident. So one doctor got slapped in the OPD. Okay, so big deal, yeah, it's okay. You didn't get hurt, you didn't get injured. So it's almost like they're waiting for somebody to get grievously injured or murdered before they will take some action. So that is the kind of indifference that I'm talking about. The second thing is that in case it comes to their notice, one of the standard responses that I have noticed amongst my own colleagues is blame the victim. So, sister, brother, you are not really, you should have known better. You are trained better. You should know which patient will get violent. You know this, you should have had experience by now of 10 years to be able to manage a violent relative. So, it's almost like the blame is being shifted onto the healthcare worker being not being smart enough. And therefore, the responsibility of the episode is theirs. These are two things that come from management perspective. Another thing that is there in hospitals is any hospital is a lack of a support system. There are no protocols of this kind. If this happens, what are you supposed to do? Now I understand that there is something called a white code, which is part of JCI and NABH. I don't know about NABH, but JCI definitely. So white code is when a healthcare worker is being assaulted. This is the problem. And what is the protocol? So, somebody says that you should have an alarm system where you ring the bell or something, and then some people will come to support you. Which people will come? Who will come? So, if I'm on duty in ICU and I'm getting abused and I ring an alarm, who will come and help me? There need to be a proper system of these are the three people who will come. This is what they will do. This is what they will not do. This is how they will escalate. This is how they will inform others so that the situation is contained. So there are these protocols, which don't exist. So the other thing is there is no system for reporting incidents. So something happens, with regard to what we call critical incidents or emergencies with patients. They are called sentinel events. They are reported. But healthcare workers getting assaulted, what is the mechanism to report? Yeah, I'm a nurse. I got somebody touched me inappropriately. Where do I go? Who do I talk with? How do I report it? Is there a system? So these things are lacking. And of course, security, another big issue which we will address in the solution part. But yes, there is a lack of security or inadequate security. Sometimes security doesn't exist at all. And last but not the least, I think in the support system, we don't have any training for healthcare workers to manage such situations. So this is the main part of what I call the lack of a support system.